Located north of Harare, this is one of the fastest growing settlements. It's a mixture of both urban and rural communities. This is not the first time something strange has happened here. And the latest of such is the burnt and dumped baby.
Ndapinda mugomba muya ndiri kunyatsoona kuti nechini zvine zvandinofungidzira zvingadaro imbwa ingaite nzeve dzakaita sedzemunhu hakuna zvakadaro. Ndobva ndinatsoona kuti uyu munhu mwana mucheche. Ndobva ndadaidza mwene Mr. Piri vanoshandira pamataya apa ndopatotandarira apa. Ndobva ndati Mr. Mwene hemuone vaPiri. Ndobva vati zveshuwa munhu uyu.
Nyaya taona mwana. Vanhu vakatanga kufungidzira munhu wavaiziva akanga ane nhumbu. Tiningi panapa akanga ane nhumbu tine munhu watunoziva. Asi munhu uyu wai asipo patakaungana. Ndo pakabva paenda kunoonekwa munhu yeye akabva atorwa nevakamutora achibva vaenda naye kuchipatara. Kuchipatara ndo kwakazobuda kuti mwana akanga ari wake ndiye akanga atirasira mwana pagomba.
It is at this dump pit that the newly born was burnt. One of the witnesses who discovered the remains expressed shock, and the community at large is still trying to come to terms with this tragic incident.
Asi zvinhu zvakandirwadza zvisingaiti. Zvinhu zvakandirwadza mwana mudiki pasina chaanoziva asina chipomerwa. Zvakandibata-batana nasi zvichiri kundirwadza. Hazvina kundifadza zvinhu izvozvo.
There's so many schools of thought circulating. Some believe it's umjolo, infertility issues. Some say it's rituals. But what led to this couple to commit such a gruesome act? This is the question asked by these community members.
Akanga atya munhu aigara naye kana kuti vakaudzana kuti nhumbu yandiide kana kuti zvakazenge zvadi panotinetsei ipapo.
Murume pakatorwa mukadzi, murume akasara achipopota achiti mimi panguva iyoyi yamatora mushandi wangu mari yandiri kuruzai munofanira kutoibhadhara nekuti mimi matora mushandi wangu nhumbu yake achinayo. Inonzi deformation of character yamuri kuita iyoyo. Tichienda kuhospital hatinambomuteerera takangoenda kuhospital.
For the customers who frequent this bar, the memory lingers in their mind, though they deeply long to erase it.
My activities ese akaipwa ese anoitwa pano. Mbanje dzinotengeswa, makasa anorara achichovhwa usiku hwese, music aidzimwe, mune vakakomberedzwa vanenge vari mumudzimba umu. Munoona mumusha munomu 24 hours music ichirira chete, nyangwe musina munhu, nyangwe mune munhu. Kana vanenge vachiona izvi bhawa ngarivharwira, achida kuti bhawa rivharwire. Tione vabusinessmen anenge achipinda mucommunity, achibatsira necommunity. Kwete kuti tidzidzisa vana vedu vese kunwa ngirini kuputa mbanje, kunwa wawa. Vazhinji vakatanga kutoputira mbanje imo mubhawa umu.
Cases of infanticide are normally driven by poverty, emotional distress, cultural or gender-based factors, but the Domboshava case seems to be quite unique.
Saka inini semazira ndeto mukomana uyu munhu wekuti munhu anoita zvevasikana. Saka muchire mekunge akushanda mubhawa memukomana uyu tonga akatombosara kwemawikisi anoita 2 or 3 weeks mukomana sipo aenda kubaza kwaanoshandira. Then after zvadaro takazoona musikana semona ndaimuita musikana akanga ane pamiri shuwa ndaitoonawo pamiri.
Panyaya yemwana iri mumaoko emapurisa. Maoko emapurisa ndiwo anoziva. Sange seni zvangu handinyanyo komenta pamusoro pezvo zvemwana, asi mapurisa ndiwo arikuti katite mapurisa aite basa rawo. Kana apedza kuita zvaanopedzawo nemunhu wavo, hatidi kuvhiringidza ma-investigations. Kana apedza isusu varidzi vemusha tichaona kuti toita sei.
According to Zimbabwe Prisons and Correctional Services, 29 people were put behind bars in 2020 for the crime. The figure dropped to 17 the following year, that is 2022. Interestingly, there was no record of anyone being imprisoned in 2023. But that is not to say the crime was not committed.
Pamabhawa pana patotengesa pakaitika chinhu chakadai so isisi vasikana vemumabhawa tisitotanga kuongororwa because tisine moyo wakadaro kazhinji kacho. Saka mumwe wedu isisi wemumabhawa ndiye akazonzi nevanhu haasi kuwanika pari kuita sei pari kuwanikwa vamwe aripi.
Another life denied the right to live, and this is a society left in shock. And this may not be the last of such cases. Hopefully the law will take its course and give this community some sort of closure. For ZTM Prime, I am Sitachi Siwegwaza.
quite a concerning report. Thank you, Stachisiwe, for being on the ground and giving us that story. Now, National Police spokesperson Commissioner Paul Nyati could not immediately confirm the incident and provide further details. We're now joined by psychologist Metha Nyamande to discuss infanticide. Good evening, Metha. If you may shed more light in terms of what could be some of the causes of infanticide, and maybe if you could just bring us into balance in terms of what this actually means.
To talk about infanticides is basically the idea of a baby being killed by its own parent. Now, there are a number of causes around why people end up doing this. Now, one of the first things that I want us to talk about and think about is the idea around mental health issues. Now, this is an area that is not very well understood, especially when it comes to the idea of severe depression, postnatal depression or postpartum depression, and other mental health disorders like schizophrenia or any other psychotic presentation that could cause a mother to believe that a baby has been bewitched or is bewitching her, or whatever it is that affects a parent's perception of their baby and then feeling the need to wanting to harm that baby. So that's one of the main causes. And then we also then see elements of the abuse of the parents. If the parents themselves have gone through abuse, chances are that can also become an issue for the baby, and babies born in those kind of environment tend to become vulnerable.
Of course, there are more questions than answers to this type of crime. Are there any telltale signs that perhaps give an indication that a couple could commit such kind of a crime?
So the signs to look at or to look for in couples is usually the issues around gender-based violence. So usually you find in a home where there is domestic abuse, violence, drug abuse as well, and mental health issues that are poorly managed, chances are we are likely to see the babies in that environment being exposed to what we would call adverse childhood experiences. So these are some of the things that perhaps social services would look at when a baby is born, when mom goes to hospital and they notice that there is aggression from dad or there is neglect from mom. Those are some of the things that healthcare professionals should look at and kind of look at ways to mitigate for those kind of situations. Maybe provide some support, sociological, social services type support, or psychological, where they're referred to some mental health professionals to provide support for them.
Now, lastly, Metha, what could be done from a policy perspective to address such cases?
So in terms of policy, there is quite a lot of gaps in our social support services, in the sense that we haven't got effective social support services where even when you see a child being abused, you know what to do, where to report, and how that will be dealt with. And partly is because of the scarcity of resources. Where would those people be taken to? Where would they go to? So at government level, we really need to strengthen our social support services so that our social workers are given the power to actually exercise the support that families need. And also, we also need to start looking at community care centers, community care support centers for families, So if a family is struggling, instead of waiting for something to go wrong, they should have access to a community center where they can go to and see someone, even on an informal level, to say, we are struggling and we need help. So those are some of the things that we need to look at in terms of policy.
Konapo ipapo pa ZTN Prime, DSTV channel 294, the place to be.